Hi, my name is Devin Romano, and I did Lyme disease for my disease presentation. So, Lyme disease is caused by the bacteria Borrelia burgdorferi, and it's also caused by two other strains in Europe, which are Borrelia asvali and Borrelia guerini. And it is only transmitted by the black-legged tick. However, it can be transmitted from the mother to the child, to the fetus, if the mother goes untreated. So symptoms of Lyme disease are fever, headache, fatigue, and also the characteristic skin rash, which is called the erythema migrans, or more commonly called the bullseye rash. And symptoms can appear from 3 to 30 days after tick bite, and they can last anywhere from weeks to months afterwards. So the bullseye rash actually only occurs in 70 to 80% of people, and it can be on any area of the body, so it doesn't have to be where the tick bites you. It can span 12 inches or more across, and it can feel warm to the touch, though it is rarely painful or itchy. Some long-lasting symptoms of Lyme disease include arthritis with some severe joint pain and swelling, facial palsy, dizziness, nerve pain, and also short-term memory. So vectors of Lyme disease are two types of ticks found in the United States. There's the black-legged tick or the deer tick, which is found in northeastern, mid-Atlantic, and north-central United States. And there's the western black-legged tick, which is found on the Pacific coast. And Lyme disease is usually transmitted by the nymph stage. So these pictures here indicate the adult stage, and I'll talk a little bit more about the nymph stage in the next slide. So the tick life cycle. There are 4 stages. It starts out with the egg, the larva, the nymph, and then the adult. And every stage of the tick's life requires some kind of blood meal, some kind of host in order for them to survive. So they can feed from any animal, so mammals, reptiles, birds, even amphibians, and generally they live for 2 years. And the reason the nymph is one of the main causes of Lyme disease is because they are so small. And so if you're bitten by a nymph, often you won't even know it because you can't see them. So part of that is that the ticks actually can't jump or fly. So the way they latch on to a host is they sit on either a blade of grass or maybe a bush, and they actually stick their legs up in the air, and they latch on to whatever passes by. So it could be an animal's fur, it could be a human's clothing, and then from there they will crawl up the body to find a perfect place to feed, which is normally some place that's warm and dark where they won't be bothered. And the start of the feeding process can take anywhere from 10 minutes to 2 hours, and they can suck blood for several days, and after they feed they do drop off. However, I'll go into that more later. So when they feed, they cut the skin and they'll insert a feeding tube. And when they insert that feeding tube, they'll secrete a cement-like substance that'll anchor them to their host, which causes them to, if they're jarred or some kind of movement on the host occurs, they won't fall off. And another thing they do is they actually inject anesthetic properties, so the host can't feel the tick biting them. So not only can you not see the tick, but you can't even feel the tick, which is part of the reason Lyme disease is so prevalent. So the bacteria is transmitted from the tick to the human, and the tick must be attached for 36 to 48 hours in order for the bacteria to be transmitted. So if you actually get the tick off within 24 hours of being bitten, you have substantially less chances of contracting Lyme disease. You should, however, still get tested to be sure. But generally they see the rise in Lyme disease prognosis in the spring to summer months because that's when the nymphs are most active. And as I've said, the nymphs generally are the ones that cause most of Lyme disease. So the tick removal, generally or always use tweezers, never use your fingers. And be sure, if you can, to remove the mouth parts. If it's not possible, don't go digging around in the skin because that could just exacerbate the problem, make it worse. And when you are disposing of the tick, do not crush it with your fingers. This is to prevent any bacteria that are within the tick from getting on your fingers and maybe rubbing it into your skin or anything else. And also avoid fake remedies, and these generally focus on getting the tick to drop off, when in reality you don't want to wait for that. You want to get the tick off as soon as you find it. So some of these remedies, some of these fake remedies, are things like painting the tick with nail polish, using heat, even using petroleum jelly. So the bacteria, Borrelia burgdorferi, is transmitted from the tick's salivary glands into the host's bloodstream. Now, the bacteria itself replicates in the tick's midgut. However, the tick is not born with this bacteria. It's not inherent to the black-legged tick. The tick contracts this bacteria from mice in its larval stage. And then, of course, it passes from the tick to the human during the nymph stage. So Borrelia has an amazing ability to adapt to its host environment. For example, body temperature. Humans have a body temperature of 37 to 39 degrees Celsius. Whereas ticks, when they feed on a host, their body temperature is going to increase because they have this warm mammal blood inside of them. However, when they haven't fed, or maybe when they fed something like a reptile, it's not going to be as warm. So therefore, the bacteria has to adapt to this changing temperature. As well, with pH, human blood is neutral, or mammal blood is neutral, whereas tick blood is basic. So again, the bacteria actually has to physiologically alter its gene expression in order to adapt. And this is actually really interesting, and part of the reason this bacteria is so difficult to get rid of, as I'll go into more later. So again, because this bacteria is so capable to adapting to its environment, it's actually very difficult to diagnose. So the bacteria has a low replication rate compared to other bacteria, and it can hide in the tissue. It can evade the host's immune system by hiding in the tissues of the body, so that the immune system can't find it. And so actually the bacteria doesn't have any toxins that it secretes. So the reaction in the body is caused primarily, actually completely, by antibodies that are created by the immune system. So when they test for Lyme disease, they're testing only for antibodies for this bacteria. And there are two tests that they do, and they're a back-to-back kind of test. There's the enzyme-linked immunosorbent assay, or the ELISA test, and there's the Western blot test. So if they test positive for the ELISA test, they then follow up with the Western blot test. And if it tests positive for the Western blot, you have Lyme disease. The big problem with this test is it actually misses 60% of cases. And I think this is part of the problem is the bacteria, again, can hide. So maybe the body hasn't created enough antibodies for them to see it in a test. As well, it can take 3 to 30 days for symptoms to show up. So you could have it and not even realize that you do. And you could go to get tested and it could be negative, but you could still have it. And this is part of the reason Lyme disease is such a big problem. So there's a chronic Lyme disease, or as what they refer to as post-treatment Lyme disease. I don't generally like to call it chronic. Is not well understood because they're not really sure why it happens. There are debates. It's kind of controversial. Some scientists, some doctors think it's caused by maybe an autoimmune response or residual muscle damage from the Lyme disease, whereas others argue that it's actually caused from this bacteria that reappears, and it can go to the skin, joints, heart, bladder, spleen, and so they don't really know. And what they do know is that people who are chronic Lyme disease patients actually are considered to have a worse quality of life than on other chronic diseases, such as diabetes, multiple sclerosis, arthritis. So you don't really hear about post-treatment Lyme disease a lot, and it's interesting because the fact that it is considered to be worse. And so, unfortunately, after you have this test, and after you have like the Western blot test and the ELISA test, and after you're treated for Lyme disease, there is actually no way to be sure that you've you've killed off all the bacteria. So that's another reason that it's not well understood, because you could still have bacteria hiding latent inside of you somewhere, and again, like they reemerge years later in this post-treatment form. So treatment for Lyme disease and post-Lyme disease are the antibiotics. So in early stage Lyme disease, before if they're able to catch it in plenty of time, they treat it with antibiotics like amoxicillin or doxycycline. Now, post-treatment Lyme disease, that's another controversial issue, because some scientists say that you should have a long antibiotic treatment, and so you take it for a very long period of time. Whereas others say, okay, there are risks associated with that. That could be antibiotic resistance. It could be because antibiotics, you shouldn't take them for a long time because, of course, it can start to negatively affect your natural microbiota in your body. So, again, there's really no straightforward answer. It just depends on your doctor's interpretation. Now, the best treatment for Lyme disease is just to try your best to prevent getting it. Now, this can include wearing long sleeves and pants when you go outside. So when you go into areas like you go hiking and there's long grass, lots of trees, it's very brushy, then you should definitely wear long pants and sleeves in general to prevent getting bitten by mosquitoes and other bugs. And some people suggest spraying clothing with a product called permethrin, which is a tick repellent. So you spray your clothes and then you can wash them and they'll stay on your clothes. You could also just use insect repellent so you don't have to spray your clothes with things. And then another thing you should do is if for post-hiking or post-working outside, check your clothing, your gear, check your pets, children, and be sure to check in areas that are kind of hidden, hard to reach, like under the arms, in the ears, the belly button, back of the knees. And, because nymphs are so small, you have to look very, very closely. And the thing is about Lyme disease, it actually has been reported in every single state. So no matter if your state has a low Lyme disease count, you should still be wary. The only state that hasn't been reported in is Hawaii, so maybe we should all move to Hawaii. In conclusion, if you think you have Lyme disease, don't panic, get tested, and in the future, whenever you go hiking, think about this presentation and don't forget to wear bug spray and protect yourself. These are my references, and thank you. See you on Wednesday.